Welcome to Doc Talk Live. I'm Dr. Brad Goodman, and I'm with Dr. Gary Bullock today. Gary, thank you for coming in and talking to us a little bit today. Dr. Bullock is a physician who specializes in adult ADHD, correct?
Correct. I treat all age groups, with mainly adults.
And when we think of ADHD, we generally think of kids. We don't really think of it in terms of adults. So, two questions. One is how common is it in adults? And the other question is how did you get interested in getting so micro-focused into actually a huge, probably issue?
Right, okay, so...
And complicated and controversial, too.
all that, and then some. As to the first question, let's go back a bit. Give me some clarity on what exactly you want to know on the first side of that.
On how common is it?
Common, okay. It's really hard to make distinctions between how common it is among kids, because it's fairly well caught, I think, among children with ADHD. Maybe not so much with females as males, but by and large, the kids with dysfunction are picked up fairly commonly, with teachers being more aware of it. Parents are more aware and less wary of the stigma. Adults, it presents differently, I would say. It's rare to have an adult with ADHD come in because they were caught at work chewing a yellow crayon like a kid would at school, or even for things as common and as obvious as mere inattention. I don't think I've had anybody come to see me because they can't find their keys often enough. It's usually more presentation of a certain type of anxiety, maybe even a certain type of OCD-ish behaviors.
All right, I'm going to get back to that. So how did you get super specialized into treating adults or all people with ADHD, but how did you get sort of narrowed into that topic? What led you to that?
That's a $1 million question. I still look back, and it seems like one of those decisions in life that was kind of made for me along the way. My background's in family medicine, especially in preventive health. My background's in epidemiology. I love the idea of preventing things without using medicine if at all possible. When it came to the ADHD part, I made it through medical school and was almost done with my residency before I knew that I had it myself. I was diagnosed in the intensive care unit when I was rotating through there. I loved it, loved the ICU, got there early, stayed late. Would blurt out answers on rounds that ended up being right and have no idea how they were right, and then stumble over my words when it was time to present a patient's blood pressure or something common like that. So I think our attending recognized that in me and had me take advantage of our facilities there in Georgia.
So somebody recognized in you that you had ADHD.
Correct.
As a high-functioning adult.
Correct.
And so how would I know if I had ADHD?
Well, that's a loaded question. That's a good one, though.
Right. I tend to think that even Blake was saying, I have ADHD. I have ADHD. I have ADHD. How do I evaluate that? How do I look into that?
Okay, first, the book answer, and it's important to have a book answer. We have to have guidelines in medicine, otherwise we're just applying labels to people willy-nilly. And I think it's pretty commonly known that ADHD is treated with a controlled substance, which can be dangerous if it's just thrown around, as the impression might be. For adults with ADHD, again, the presentation is not quite as obvious as one would think. Astute clinicians will pick it up, usually in primary care. But as I alluded to before, the symptoms might be a bit paradoxical. It could be more of a particular type of anxiety, a particular type of depression, and even the word depression doesn't fit. It's more of a long-term pathological compounded frustration. My patients do not present, in my experience, as a person looking for medication. The average adult with ADHD would resent having to take a Motrin for a headache. They're just not really pill people, and by the time they come to see me, it's usually because some precipitating event, family member or something at work has happened where they just can't manage it anymore with traits that might look a bit like OCD.
So I'm doing a lot of inferring, okay, which is to say that I've heard you mention depression, I've heard you mention anxiety, and I need a practical way.
Gotcha.
I need a practical way to understand what ADHD is.
Right.
And also I want people who are watching Doc Talk Live to have a very practical way. So I'm going to say something in simple terms.
I'm getting some good questions.
Let me finish my thought before we go to those, but I'm going to say things in very simple terms, and correct me if I'm wrong, but would it be all right for me to think of ADHD as some sort of underlying stress disorder, and your brain is trying to suppress the stress by paying attention elsewhere?
That is actually a good functional definition. It's better than the book definition.
So if that is true, and I don't want to treat it with drugs, then that means I have to get at the underlying stressor. Is that true or not?
It depends what you mean stressor.
Well, do I have to get underneath whatever it is that may be bothering me in order to really fix the ADHD? Or is there a cognitive behavioral way, as opposed to a psychoanalytic way, of addressing, so it sounds like it's really not ADHD. ADHD is a symptom of something else. It's a symptom of some anxiety, some depression, some stress or something in your life. Do you see what I'm getting at?
Yes, but I would say the ADHD is that stressor, at least one of the major stressors, because it's got a strong genetic component. There's only one thing in pediatrics, for example, that's more closely predictable through genetics, and that's height.
Really?
Right.
So what is the genetic link to ADHD?
Okay, so the simple answer, the book answer that we have to perform on the board exams would be, and you got to start somewhere.
Right.
If one parent has ADHD diagnosed at any point in life, the child has a 30-something percent chance of having ADHD. If both, it's a 77% chance. Then you wonder about the other 33% or 23%. Are they maybe overcompensating with anxiety? The deeper answer is, and this is where speculation for anybody watching who's in the science fields, there's evidence in another field besides medicine called anthropology, study of the human race and how it developed, that there's a strong correlation between Neanderthal genetics. And before you take Neanderthals an insult, Neanderthals were the first to produce art 40,000 years ago in Spain, before Cro-Magnon humans, more closely aligned with modern humans, appeared. And there's a lot of thought that the survival gene necessary to make it in the harshest climate of the Alps versus the plains of Africa are those genes that now migrated back into the human race at large, so that 4 to 11% of us have this particular gene or set of genes, and it predisposes us to have a kind of a split in our function. We may excel in one area, and then in other areas, usually mundane but necessary areas, will fail, like we have blind spots. So, going back on something I should have laid out first, the book answer for the definition of ADHD. It is a neurocognitive disorder. It's not a psychiatric disorder. Until you have kids with ADD, then there's some psychology involved.
Well, it's complicated.
Yes.
And so let me, Blake, you said there were some questions out there. Are they still there?
Yeah, there's a lot. I mean,
right.
It's such a popular thing.
So we're blowing up, is what you're saying.
So actually, right now, while we're on the discussion about what is the imbalance, the last question I had is, what neurochemical imbalance is associated with ADHD?
The two neurochemicals most closely associated with the dysfunctions with ADHD, number one is dopamine. The other one is called norepinephrine, and it's only in one particular tract of the brain that connects the prefrontal cortex, where we initiate ideas and thoughts and actions, to the midbrain that gets them done. And here's where the split is. We have more dopamine when it comes to something that's extremely challenging, especially if somebody has told us, you can't do that, and we get to prove them wrong. Then something lights up in our subconscious and we'll accomplish it, and then some. But then other things that are mundane, like, did you take the garbage out? Oh, meant to, but then I got to the kitchen and saw the coffee cup and I noticed we were out of detergent, so I went to Target and came back, and that whole sequence of events happens. So dopamine and norepinephrine, short supply for the mundane, in ample supply for things that are very, very challenging.
You have more, Blake, or you want me to?
Yeah.
And let me just take a pause here. If you're just watching Doc Talk Live now for the first time, or if you're tuning into this on a rebroadcast, ultimately what I want Doc Talk Live to be is something that our audience can participate in and really direct the information that they want to have. And so I appreciate any comments you can put down with regard to it. It helps us. It helps us learn what shows we need to do. It helps grow our show, and more people can see us. That's what I'm told, at least. Go ahead, Blake.
So I'm going to try to put these questions in order so that they kind of, we're not asking the same thing twice and they kind of go together. So one of the previous ones is, what type of testing do you do for ADD?
Okay, so by definition, and this goes back to what I think I've failed 3 times now to lay down the groundwork of ADHD. It is a developmental delay of executive function, not an absence of executive function. Executive function, by and large, is the ability to formulate the right task to do, the timing to do it in, the ability to start that task and finish it amidst distraction, which everybody has. The ADD mind doesn't necessarily, in mundane situations, have the ability to return to a task after a unmitigatable distraction. Then there's a hard...
So what you just said is that the ADHD mind is easily distracted.
Very much so, yes.
Okay, go ahead.
And so then with long-term goals that are rightful goals, that are very challenging, that take a long time, there's a tendency to lose the emotional voltage regulation. So if I have a long-term goal, let's just randomly pick a 72 Corvette. Some of us would love to have a 72 Corvette at one time in our lives. That goal seems so distant and so overwhelming that the daily tasks to get there that might be mundane, like saving money and balancing the checkbook, may fall under the radar because the goal may seem too lofty. Whereas somebody with an average brain, average nervous system, wouldn't have a hard time plotting the course along the way, the smaller steps. Then there's learning from past mistakes. There's a tendency for people with ADHD to say, I have no idea why I did that again. What is wrong with me? I did that again.
And how do you, the question was, how do you test for it, right? Is there a computer screen test that you give in the office? Or
there are some good tests out there, but the official way to test for ADHD is, this is where it gets complicated. It is in a structured clinical interview with somebody who knows ADD backwards and forwards. There's 2.
So that's where somebody like you comes in.
Like myself, a neurologist, a family medicine doctor, internist. The tools, though, and this is where I think a lot of my peers get unnecessarily frightened away from diagnosing and treating ADHD in their patients. The one major tool for adults with ADHD is the Adult Self-Rating Scale, the ASRS. There's a screening portion. There's 6 questions up top of 18 total. Those 6 questions are pretty sensitive and specific. If there are 4 positive out of those 6, then that person needs further testing. And that's something that could just be sitting out in the waiting room, especially for patients who have anxiety and depression symptoms that don't quite respond right to your first round of SSRI or cognitive therapy. Then, all told, the definition, if you have 5 answers that are considered significant in the adult self-rating scale out of 18, 5 that are either impulsive or 5 that are distractible, then that meets criteria. The second catch, this is kind of like diagnosing rheumatoid arthritis. 2 of these and 4 of these and 4 of these, unless 2 of these,
frustrating.
But after a while you get the hang of it. It's easy to look up, but it's that on the person's self-assessment, and then somebody at home who says, yeah, at home they have the same problems, and then somebody who knows them outside the home, so it's not just the domain.
So the next time we sit down to do a Doc Talk Live, I want to answer those questions.
Okay, fine. Good enough.
I think that will help us relate to, you know, what it is you do and how you evaluate people.
Yeah.
So let's come back and revisit that at some point.
Fair enough.
What else you got for us, Blake?
Well, I'm going to kind of piggyback on that question, Alan. How often do you think it's misdiagnosed?
Oh. And if it's misdiagnosed, what's it diagnosed as?
Okay, so my opinion, and I'm biased, okay, because I've got 6 kids, and all 6 have been diagnosed with ADHD, not by me. 3 of them are mine genetically, and 3 are somebody else's fault. Either way, they're all my kids, and they all have ADHD. One is on the far extreme in her OCD behaviors and approach to life. In my opinion, watching her grow up is her desire to compensate, and it's just horrifying to watch sometimes. Another one, I think he's probably going to know the whole Hoover police force before he graduates. His is more oppositional and defiant, and it's just like there's an engine inside this kid that he's slowly learning how to control. And then there's varying permutations along the way. So, is that coming close to answering the question?
Well, yeah, no, it is. I think the thing, just being, still kind of going to college and everything, you still see these people that are, I mean, one of the most popular drugs out there, I'm sure you know what I'm going to say, is
right.
Adderall. And it's, it seems like everybody is going to doctors and getting diagnosed with ADHD so they can get Adderall and spend these all-nighters on cramming, doing tests, papers, whatever it is. And I mean, to me, it seems like that's one of the most popular drugs amongst college kids. And I guess, like, how often is that, I don't want to say misused, maybe miswritten when it shouldn't be? Like, because that's kind of some of the questions is, what drugs are used for those? And
tell us about,
give
us the Adderall story.
Yeah.
Okay, so there's a thought commonly around these parts that is in the vending machines in Tuscaloosa and at Auburn. and you can't help but feel that way because you hear these stories, these kids coming in and they're like, yeah, I had an all-nighter and I didn't have my medicine, so I just borrowed some from down the hall, or I've never been diagnosed. But man, a buddy of mine lent me a 5 milligram Adderall and I stayed up five more hours studying. Okay, first of all, maybe they have ADD, maybe not. Doesn't matter. That's just wrong on so many levels. I've known of at least one student at Tuscaloosa to overdose and die. He wasn't properly diagnosed. So when we use the term controlled substance, it's called control for reasons. Department of Justice. It's not the medical board. It's the Department of Justice laying down those laws to protect society from itself. It's hard enough for doctors with 20 years experience to diagnose ADHD, and I wouldn't expect a teenager or a young adult to be able to do that successfully and not on themselves at all. Ironically, I still see it being underdiagnosed. Maybe in the single digits, less than 10% of the adults with ADHD are probably diagnosed and treated.
So in the adults, it's underdiagnosed.
Probably in both kids and adults.
It sounds like the medications may be overused as opposed to addressing some other things that could be addressed.
Overused in those who don't have ADHD and underused in those who do.
Okay. In the beginning of our talk, you mentioned that you do not like to use medicines if you can avoid it. You like to try to do things natural. So what are some of those natural treatments that seem to work in your hands?
First, on that note, I don't think any physician that I've ever been affiliated with has ever, liked pushing the medicine first. We just fall into these ruts and we're not thinking about it. But so first and foremost, understanding ADHD is huge. At any level, a kid 6 years old, they can have the main information broken down to where they can understand it, to people in their mid-50s to whatnot. It is a bit complicated, but after a few good conversations, I think anybody can understand where their brain is not working like other people, where it works better, but where it works worse. Knowing that first clears up the blind spot aspect, the anxiety of not knowing when I'm going to screw up next. So that part of knowledge is very essential to get up front, especially the part that we've left out of the diagnostic manual. Doctors use a particular book called the DSM-5 to diagnose ADHD. In the past 3 iterations, the largest component has been left out, and that's called emotional dysregulation. It's not that we have the wrong emotions. We have the right emotions in the right circumstances. The intensity is an 8-cylinder engine versus a 4-cylinder engine. And in the right circumstances, I can land you in jail or divorce court or whatever. So it's a very important part of that that's been left out. And people like Russell Barkley, who's up at South Carolina, PhD, he's been pushing for the better part of his career to get that back included. It was in 1969 to 90.
I have kind of one more question. Smartphones. I see people, me included, constantly into the smartphone. It's like I'm disengaged and I'm distracted by, by Facebook, by social media, by whatever I can find on my phone to occupy me. What are your thoughts there?
It's a great example of the irony of ADHD. Steve Jobs, if you can give him credit for making the iPhone indispensable and therefore all smartphones, would not have come up with it if it wasn't for his imaginative ADHD. But I Googled it, and Google said that the smartphones were not making ADHD worse. I'm kidding, of course.
Dr. Google said that.
But no, the technocratic society that we're in, the fact that we are dependent on our phones and other devices has made ADD
Well,
worse.
the phone is stimulating. It's
Absolutely.
constantly offering probably dopamine.
It's addiction. Absolutely dopamine.
Instant gratification. Right?
Yeah,
It's like
Just
that instant fix.
something to occupy me, whereas before all this, I'm old enough where we didn't have computers and phones and all that. We watched television.
Yeah, right. 3 channels.
Exactly.
Simon Sinek is, he was a TED Talk guy, third most popular TED Talk, Leaders Eat Last. But he's pointed to anthropology studies where, the dopamine release from getting a like on your Facebook is absolutely addictive. Absolutely addictive.
Any more, Blake, or can we?
Yes, this was a good one, I thought. Does early caffeine use play a role in stimulant dependence in adult ADHD?
No.
No? Okay.
Let me say a few things. So, Gary Bullock, how do people find you if they want to be formally evaluated and treated for ADHD?
One-stop shopping is drgarybullock.com. That's drgarybullock.com. drgarybullock.com. Got one blog entry about what it's like to have ADD as an adult. That's worth reading. And then scheduling's online, the explanation of office policies, all online, directions online.
And if you'll do us a favor, if you can somehow link to Doc Talk Live and maybe answer.
Yeah, because there's a lot of questions.
Somehow answer the questions too, because I won't be able to answer them all, just because I won't know the answer.
Right.
But I appreciate whatever you can do to maybe reply to some of these questions. Gary, I want to thank you. I want to invite you back.
Sure,
Specifically, I would like you to do some informal clinical, assessment of me.
Absolutely.
And just or Blake.
Yeah, I can tell you my ADHD story in a...
Go ahead, Blake. Do you want to?
Well, no, it's just, so, in high school it was so much easier. Like, I never had to really study. It just came so easy.
Come on over here, Blake.
Come on, Blake.
Come on over here. Let me switch spots with you, Blake.
You're gonna high school. So I never had to study really. I mean, it was really easy. Yeah, I mean, it was just, I don't ever remember staying up late studying.
Public school?
Yes, that's my problem. I had to go to private school like Dr. Goodman.
So I was blessed. I was blessed that my parents sent me to private school, where I was blessed that way.
It does make a difference.
It definitely made a difference in my case. There's no question about it.
But like going into college now, you're studying harder topics and in depth and all these reading materials that you don't really care about, but you have to read. And I would find myself reading page after page, and then catch myself like, I have no idea what the hell I just read. Like literally, I would read 3 pages. I'm like, what? I don't know what I just read.
What is wrong with me? Exactly.
So was put on a low dose Adderall, and it seems like it just changes everything. You get in depth of what you're reading, and I'm sure you've heard that story a million times and
experienced it.
Yeah. So
So
what is it about that? So why
what's your comment there, Gary?
That I experienced the same thing.
What would you tell our listeners or viewers about what Blake just related?
On the heels of that, if there's a suspicion that there's ADD, don't put off testing. After my diagnosis, I put off treatment for 5 years, just afraid of the stereotype.
There is a question on here. It says, why does France have half the diagnosis rate of ADHD as the U.S.? Is it medical culture?
I think it's culture, and that is a brilliant question. If I'm guessing what's behind that, my American answer is, well, they're French. Then there's a longer answer. It's like comparing the French medical culture. Yeah, it's free, but in 2003 they had a heat wave, and without air conditioning, 10,000 people died in the hospital, so it's not as good as it sounds. Number 2, it's all about definition. every Marine I've ever treated in over 14 years of taking TRICARE insurance, every Marine has been previously diagnosed with either ADHD or restless leg syndrome, which are closely aligned. Didn't have ADHD in the service. Did have ADHD troubles upon discharge in civilian life. Same with Army Rangers and pilots. There's just a predilection there.
Okay, I'm going to leave it there. We'll come back. We'll do more on ADHD. And
You've got to take the test, right? You're gonna
yeah, I want to take the test.
Yeah, absolutely.
Yeah, I think that's what I want to do. All right, I'm going to hit finish.